Today for a free consultation, 690-3707.
Hi folks, I'm Rodney French from French's Shoes and Boots. We have the best brands at the best prices. From men's and women's dress and casual shoes to work and western boots, French's has the top brands for the entire family. Shoe brands like Merrell, Dansko, SAS, Nike, and more. Boot brands like Red Wing, Justin, Timberland, Lucchese, Rocky, and Wolverine. All the best brands and always the best prices. Check out our designer shoe sale room. Famous brand designer shoes 50 to 90% off mall prices. French's Shoes and Boots, there's a location near you.
Join the stars at this year's CMA Awards. Watch News Channel 5 at 10 tonight. Look for the cue to call, then dial. The fifth caller wins 2 tickets to the show. Watch to win on News Channel 5 at 10 tonight. From the News Channel 5 Network, this is Medical Mondays.
Hi everyone, I'm Amy Marsalis and welcome to this installment of Medical Monday. Tonight we're really talking to a lot of you baby boomers out there, part of the population that's probably in line at some point, a lot of you, for artificial joints, be it shoulder replacement, knee replacement, hip replacement, what have you, because close to 21 million people have osteoarthritis of the knee and the hips, which is the most common cause of arthritis-related disability in the United States. And tonight we're really going to cover a lot of topics. We're going to talk about partial knee replacement, the use of computer navigation or GPS in repairing some different joints, hip resurfacing, so not a total hip replacement, but where they put a cap on, not as much cutting for people of the appropriate bone quality. We're also going to talk about shoulder replacement, and we welcome your calls tonight. As always, hope to hear from you if you have any questions or comments. Maybe you've been through a procedure or you're going through some pain right now and you need some advice. We've got the experts right here with me tonight. To my immediate left, Dr. Jeffrey Hodrick. Nice to see you. Nice to have you in. I know you've been here before about a year ago.
About a year ago.
So welcome back. And Dr. Craig Morrison, who I've interviewed in the past. Good to see you, Dr. Morrison.
Thank you.
Both orthopedic surgeons with St. Thomas Hospital to talk about joint replacement. Before we get into the nuts and bolts, if you will, of this topic, I was thinking about this as I was preparing for the show and wondering, is it simply a case of joints just wearing out over time? Because I know the majority of people you see are older, over 55 or 60. Is it people living longer, more active, injuries along with arthritis? Is there anything we can do? Sort of a two-pronged question. Is it a case of joints wearing out? And is there anything we can do really to prevent that and to keep our joints healthier longer? Either one of you.
Jeff. Sure. I think, in answer to your question, I think there's more and more people, obviously, and then the largest growing portion of that population is the baby boomer generation that are coming into that age of the 50 plus or the 50 through 70. And what we're seeing with that patient population is that they've been very active, and all aspects of medicine have gotten better. So everyone's staying obviously alive longer and staying more active longer. And I think also the expectation to be active and to be involved in things that people enjoy is at a higher level as well. So people expect to continue exercising, continue walking with their walking group, whoever it is. So they want to live their life without pain. So that's certainly a big part of why we're seeing more and more people. Now, and answer your question about arthritis, most commonly, osteoarthritis is a gradual wearing away of cartilage. And there's different reasons why that happens. Some of it's genetic. Sometimes folks have injuries to their knees, maybe, or hips earlier in their life that can cause arthritis to happen more commonly or faster at a faster rate. So we see those patients that need joint replacements. But one of the things we tell all our patients is that you should stay exercising no matter what. It's certainly not worth staying on the couch. If you have arthritis, it's probably better to start thinking about having something done about it rather than being inactive because of all the other things.
Dr. Morrison, what would you like to add to that?
Well, I was going to say, you mentioned how we could prevent it. We don't right now have a very good prevention for arthritis. I think the magic bullet would be a genetic test in the future to tell people that are predisposed to it to avoid high impact sports. But I agree with Jeff. Right now the best thing to tell people is to stay active, watch their weight. That's hard on the joints, and cartilage likes motion. So if we can stay fit, keep our weight down. That probably will keep it at bay longer.
Cartilage likes motion.
That's right.
That could be a bumper sticker for you guys, right? What is the difference between osteoarthritis and rheumatoid arthritis? Can you explain that?
Well, osteoarthritis is what we refer to when we're talking about just run-of-the-mill wear and tear arthritis, so it's by far the most common, and it's where the cartilage that coats the end of the bone wears out over time. Just sort of a mechanical thing, or in somebody with an injury that has an injury to the cartilage so that it rubs off faster. Whereas rheumatoid arthritis goes into a set of arthritis we call inflammatory arthritis. Rheumatoid arthritis, lupus, for example, or gout, where the lining of the joint that makes the joint fluid becomes inflamed and actually aggressive and physically eats away the cartilage. So osteoarthritis is more mechanical, whereas the inflammatory arthritis is like rheumatoid arthritis. We aim the treatment towards calming down the inflammation of the lining.
Okay, with the knee anatomy, I know it's the largest joint in the body. A normal knee function is required to perform most everyday activities. So what I'd like to know is if you could sort of walk me through an evaluation, like an orthopedic evaluation. Let's say you're having knee pain, it's continued, and someone comes to see you. What battery of tests, what do you do when someone comes to see you with knee
I
pain?
think it can be broken down probably into different facets. The first thing is just collecting the history. So it's what type of pain, what causes the pain, how long has it been there? Was there an injury that caused the pain to come on? Is there swelling that comes along with the pain at the same time? And then you can also break that down, what part of the knee has the pain. So then you can start localizing what it might be. And everybody that comes to our office is also going to get x-rays. That's kind of the mainstay of an orthopedic surgeon, really, is to look at the joint on an x-ray to see, number one, if there's cartilage left. Obviously, if there's a broken bone is another thing we use x-ray for. And then based on that, if that doesn't tell the story, there's certainly some other tests that we can do. Occasionally, if we think maybe it's a torn cartilage within inside the knee, then sometimes we'll order an MRI. Those are some of the most common things that we do to kind of help tell the whole story. A lot of times we can get the story mostly from the physical exam or examining the knee, and also just the story that the patient tells us.
When would you draw blood? I read that sometimes blood work is involved. When would you do that?
Well, if we're looking for something like an inflammatory arthritis, like lupus or rheumatoid arthritis, usually the history of the patient's symptoms more than their physical examination might alert us to that. So those patients often have many joint complaints, so it's not just one knee, it's their hips, their knees, their shoulders, everything hurts. They're typically younger, and the x-rays will show us usually an inflammatory arthritis. It looks a little bit different on an x-ray. So we may order some screening blood tests, and if something comes up positive, then we may refer them to a medical specialist like a rheumatologist to further work that up.
Okay, I want to ask you, I think we need to take a break, but if you've had one knee done, and I know I have at least one viewer who's had one knee done, because it's my aunt who's in town who's watching tonight. Hey, Barb. If you've had one knee done, is it likely you're going to need the other knee replaced, have a knee replacement? And I'm not talking about if you've obviously injured one knee, and so you know for sure one knee's bad. Are you likely, if you've had one replacement, to have another? I think we need to take a break, though, and take care of something, and we'll be back with your calls. Don't go anywhere. You're watching Medical Monday. We'll be right back.
This Storm 5 HD weather update brought to you by Electronic Express.
Hello everyone, I'm Ron Howes from the Storm 5 HD Weather Center. You're looking at radar now showing the precipitation out there as of right now on this Monday night. And here's a broader view of the radar over the southeastern U.S. with widespread showers and storms over much of the south. And a look at regional temperatures, these temperatures updated hourly. And here's a look now at the current conditions in Nashville. The forecast for tonight, cloudy with showers, an overnight low of 66 degrees. And then for tomorrow, a 50% chance of showers and thunderstorms, a high of 77. Rain chances increasing to 70% on Wednesday, 50% chance of rain on Thursday, and a 40% chance of rain on Friday. Skies clearing over the weekend with pleasant temperatures. And this has been a weather update from the Storm 5 HD Weather Center.
The government had its Cash for Clunkers program for new cars. Now through Labor Day, only Wilson County introduces its very own Clunkers for Cash pre-owned program. If you didn't qualify for Cash for Clunkers